Applied Pharmacology Chapter 16. We're going to cover blood-modifying antineoplastic and immunosuppressant drugs. To review, we need to think about a couple of things about the immune system and about the blood as it's made and also as it functions throughout the body. Okay? So, if we have anemia or hypoxia, this is going to stimulate the kidney to produce the hormone erythropoietin, which is going to affect the bone marrow to make red blood cells. So hematinics, the primary function is to carry oxygen to the tissue. What it's supposed to do, we know that that's that primary function. Red blood cells are formed in the bone marrow in response to stimulation by erythropoietin, so hemoglobin is made up of a protein and an iron-containing pigment. Adequate amounts of iron, cobalt, copper, B vitamins, trace minerals, and protein are all needed for normal hemoglobin and red blood cell formation. What is needed for normal hemoglobin, red blood cell formation? Don't just read it, know it. Iron, cobalt, copper, B vitamins, and if we don't have those in very specific numbers in our body, we're not going to have good hemoglobin. We're not going to have the energy that we need to get through the day. Substances that tend to promote an increase in the blood are things that are used to prevent. Primary ingredient in most of these is iron. So iron is a hematinic, allowing the blood to function as it should, or the red blood cells to function as they should. It is a vital component of hemoglobin. Some also contain copper and B vitamins to enhance the red blood cell formation. Anemia results from the excessive loss of red blood cells, formation of inadequate numbers of red blood cells, or inadequate amounts of hemoglobin in the red blood cells. So if we are losing red blood cells, we're bleeding. It's going out. If we are not making enough red blood cells, our bone marrow is not functioning normally, or we don't have enough erythropoietin to make this happen. Or if we don't have enough hemoglobin in the red blood cells, go back to this, we need iron, cobalt, copper, B vitamins, and trace minerals, and protein. Okay? So we need to eat well. Iron deficiency anemia is common in humans, but it is rare in animals that consume balanced diets. If we have to give an iron compound, there are injectable forms that are labeled for intramuscular injection and contain only iron, but they can discolor muscle tissue at the site of injection. We use it for the treatment of baby pig anemia or as a nutritional aid in some animals that need it. It just depends on the form. And again, we do not want to give it in anything but the neck muscle because this ham needs to stay pretty. It will stain the meat, even given in piglets. Okay, so we'll condemn that meat because it's been stained with an iron injection, and that's not good. So pork quality assurance programs, and you can get certified as a pork quality assurance person, and this is just telling us to give it in the neck. All right, so here's the future of hematinics. Blood substitutes. How do we substitute blood? BioPure Corporation has prepared this polymerized bovine product with a hemoglobin concentration of 13 grams per deciliter, which is high, in a modified lactated Ringer solution. The solution has obvious benefits over blood products that include availability, a long shelf life, universal compatibility, which means we don't need to do blood typing, and it's free from disease-producing agents. The hemoglobin solution picks up and distributes oxygen in a manner similar to red blood cells, but the oxygen-carrying function is shifted to the plasma versus the red blood cells. Because it's carried by the plasma, it's easier to diffuse the gas across the cell membranes because it's not only having to go through the red blood cell membrane and then through the vascular cell membrane and then through the tissue cell membrane and then through the, so it's not going through all of those membranes. There's one fewer membrane that it has to cross, so it diffuses much easier. It's compatible with any other IV fluid, but other solutions should not be mixed in the same bag. So we can give it when we're giving other IV fluids, but we want to use a separate line. We don't have to worry about blood typing or cross matching when we use it. So this polymerized bovine product is the future of a blood substitute. Okay. Anticoagulants, something that stops the blood from coagulating. It is an essential process. It's designed to inhibit the loss of vital blood constituents from the circulatory system, so it's really important. We have to understand the coagulation cascade in order to understand why anticoagulants might work. Okay? There is an intrinsic, this is intrinsic pathway, got cut off. This is an extrinsic pathway. The extrinsic pathway is a stimulus that comes outside of the blood vessel. So we have tissue factor because we've cut into the tissue. We have, and then these factors 12, 11, 9, and 8. This is von Willebrand's factor. And these all lead to this common pathway. So this extrinsic pathway and the intrinsic pathway with their different factors come together in a common pathway at factor 10, in which we have another factor 5, calcium and lipids, that contribute to thrombin formation. Thrombin is important to turn prothrombin into, and it interacts with thrombin and makes fibrinogen, okay, which forms this fibrin clot. So there's all this stuff happening in the coagulation cascade that is really important to create a clot. In order to test this pathway, we're going to use the activated partial thromboplastin time, so ATPP, and this is prothrombin time, PT, here. So there are two different tests on the blood. One tests the extrinsic pathway, you should know which one that is. One tests the intrinsic pathway, you should know which one that is, okay? So here again is the intrinsic pathway with 12, 11, 9, and 8, activated partial thromboplastin time. So I guess APTT, okay? This is activated by injury to the endothelial layer, so the inside of the blood vessel, which disrupts blood flow and causes a chain of chemical reactions leading to a thrombus or a clot. This process helps to repair the damage of the blood vessel walls that occur from routine wear and from pathologic processes, damage to the inside of the blood vessel, not the outside. Okay, it's the inside. The extrinsic pathway is injury to the tissue in the vessels, which releases tissue thromboplastin. This stimulates the clotting mechanism. So this is a cut from the outside going into the inside. Vasoconstriction is going to occur when we have damaged blood vessels, and this is going to slow blood flow and facilitate clot formation, and then we'll get platelet formation, aggregation right at the injury site, and that it adheres to each other. That's an important part of the clotting process. And again, if we want to test this, we're going to test prothrombin time. This is going to test for thromboplastin. So these two come together in the final steps of the clot formation to the common pathway. There are at least 13 clotting factors that participate in the series of reactions called a cascade. Each product of the preceding reaction promotes the next reaction. This is like dominoes that you set up, push over, and they all fall down. Okay, if we take one of these out, like von Willebrand's factor, we remove it. If you're a Doberman, a lot of Dobermans don't have it. We're going to stop the intrinsic pathway, and then this common pathway is going to be slower. It's not going to be as effective, and they're going to bleed. So the final step is fibrinogen to fibrin by thrombin. If any of these clotting factors in the cascade are deficient or missing, full clotting does not occur. We might get some partial clotting. We're not going to get full clotting. A balance must be maintained in the body between clot formation and clot breakdown. So if we had we had a great way of clotting, but we didn't break down those clots over time, then our body would be full of clots. And obviously that's not good for blood flow. So this destruction of clots happens through fibrinolysis, and this is through the action of an enzyme called plasmin. Plasmin digests those fibrin threads and other clotting products to cause clot lysis. So we remove the clot but leave the fibrin scar tissue in place. Anticoagulants work by inhibiting clot formation, specifically by tying up or inactivating one of the clotting factors to interrupt the cascade reaction. How do we use them? Heparin is used paradoxically to treat the bleeding disorder disseminated intravascular coagulation. So this bleeding disorder, it causes bleeding because we have clots all over the system, and heparin will be used to stop that. Okay. We also might use them if we have blood that is not flowing through a blood vessel. So if it's not flowing, it'll kind of stop, and when it stops, it'll clot. So we can use heparin or aspirin as an anticoagulant to keep the blood a little bit thinner and moved a little bit better. Heparin, it's an anticoagulant found in many tissues of the body and is thought to be stored in mast cells. It's obtained from pig intestinal mucosa and from bovine lung tissue, and its strength is expressed in terms of heparin units. It's used as acts as an anticoagulation, specifically by preventing conversion of prothrombin factor 2 to thrombin. So it's going to work on which side of this cascade? The extrinsic side. Okay. Without thrombin, fibrinogen is not converted to fibrin and a clot does not form. Heparin does not break down clots, but it can prevent clots from increasing in size. It's not good if they already have a clot. We don't want to use it for an anticoagulant when blood is collected for performing a differential count, because white blood cell morphology will be adversely affected. So what do we use instead? Lavender top tube with calcium EDTA. Right? A heparin flush solution may be prepared by diluting heparin in a saline at a concentration of 5 heparin units per ml. So that means that 750 units of heparin, or 750 divided by 5, will give you, 75 divided by 5. It's about 12 mils drawn up into a 60 mil syringe, and it acts as a anticoagulant when the blood is collected for transfusion. Heparin blood collection tubes have a green top. So lithium heparin is a green top. Protamine sulfate is the antidote for heparin overdose. Heparin is the antidote for protamine sulfate overdose. EDTA, or calcium EDTA, how do we use it? I just told you, it's in a lavender top tube, and it's an anticoagulant that we use primarily as within that tube to do a white cell count or a differential count. Okay. Now, calcium EDTA also chelates heavy metals, and we're going to learn about that shortly. But it also is an antidote for metal, like lead. Okay, so if we have a lead toxicity, we're going to give that. Some topicals. Topicals we would use to help with clotting. They provide a framework in which a clot may form, or by coagulating blood protein. And we're going to talk about some of the examples of this in class, but anything that provides a meshwork, obviously it needs to be something that is sterile, so I want you to think about that. There are topicals that we can use. There's gels that we can use. We can use flour or talcum powder just to provide this framework on which a clot can form. Fibrinolytic or thrombolytic drugs break down or dissolve the thrombi. So these can help to remove or reduce the size of an occluding thromboembolus and minimize tissue damage. We might use them in pulmonary thromboemboli if we have dogs after heartworm treatment that have them, or if we have cardiomyopathy in cats and a saddle thrombosis. We don't use these very often. These are used in stroke victims with humans, and they're extremely expensive drugs. Now we're going to talk about antineoplastic drugs. What are antineoplastic drugs? Well, these treat neoplasia, so cancers. We can treat neoplasia through several methods, and this is drugs, like we're going to talk about surgery, radiation to kill cells, and immune modulation. We're going to also talk about immune modulation a little bit. The goals of the treatment are to keep the neoplasia under control, increase survival time, and improve the quality of life of the patient. You need to remember that we're not going for a cure with antineoplastic drugs in pets. Okay? So it is something you need to communicate to your clients, that our goal is to improve the quality of life of the patient. We're not going to do chemotherapy if it's not improving their quality of life. It is a little bit more expensive. We're not going to necessarily prolong the animal's life or cure the cancer, but we're going to make them feel better. And if people go in with that understanding in mind, they're going to realize that it's not as bad to use it in animals as we see it in people. Cancer is a complex mutagenic disease in which genetic mutations give a cell or cells the ability to replicate in an unlimited way. This is called initiation. Form a mass of cells, which is called promotion, and invade adjacent tissue, which is called progression. Now it can invade adjacent tissue, and if it does, it's called benign. Okay, it just gets bigger. Or it can go through the bloodstream, and cells can lodge in distant tissue, and that's called metastatic. Some 6 fundamental characteristics of cancer we need to realize as we're thinking about drugs. There's a self-sufficiency in the production of cell growth signals. That means that these cells are not receiving any feedback from anywhere else in the body, which means they're not receiving negative feedback either. So nothing's telling them to stop. So they're all self-sufficient. They're all just growing little happy cells in their little happy cell world. There's an insensitivity to anti-growth signals. So even if they are receiving negative feedback, they're like, I don't care. I'm just going to keep growing. There's the ability to evade programmed cell death. Every cell in the body is programmed to die at some point. Some cells are programmed to receive replacements and some are not. These cells have the unlimited potential to replicate. They have a sustained ability to promote angiogenesis. So they feed themselves with new blood vessels in cancer masses. And they also have the capacity to invade tissue and metastasize. The principles of chemotherapy have to do with targeting proliferating cells. So whether they're found in normal tissue or in neoplasm, we're looking for those dividing cells. So in both of these, there are resting and dividing cells, but in neoplasms, there are going to be more dividing cells, and these are all involved in the phases of the cell cycle. Chemotherapy can either be directed at a specific phase of the cell cycle or can affect all phases of the cell cycle. This is called cycle nonspecific. They're most effective against rapidly growing tumors, rapidly dividing cells. So they're going to be very effective against young cells, cells in a child's body that are rapidly growing, or cells in reproductive tract, because actively dividing cells are more sensitive to DNA damage in the cell cycle. Chemotherapy is used to treat a tumor with a known sensitivity to a drug or drugs. This means we need to do testing and studies in order to understand that. They make cancer cells more sensitive to radiation or other therapy methods. They reduce or eliminate metastases. They can help reduce tumor size if we're going to relieve pain or to improve function or to facilitate surgical removal. Effectiveness, the most important way to determine effectiveness is the length of time that a tumor is exposed to an effective dose of the drug. So the longer that drug is in contact with the tumor, the more effective it will be. Another significant factor is the development of specific resistance to a drug by the tumor. Because the tumor is constantly mutating and replicating itself, it can develop a resistance to that drug pretty quickly. So we want to give high doses to kill it as quickly as possible. A traditional way of using chemotherapy is to give the maximum tolerated dose for the shortest time possible, but alternatively, you could give a frequent low dose over a longer period of time. That's called a metronomic method. Tend to feel better that way because you're not getting as sick, you're not killing as many healthy cells that way, but in some cases it is not as effective. We often give chemotherapy drugs and combinations to improve their overall effectiveness, just like when we do multimodal pain relief. Different tumors are treated with very specific combinations of drugs. If you've worked with an oncologist, they're going to start to refer to things as certain protocols, okay, using different drugs together in certain protocols. Those durations, the doses, and the intervals are all determined by very carefully designed treatment protocols. All chemotherapy agents are indiscriminately targeting rapidly dividing cells, and they have low therapeutic indexes, which means they're very dangerous. So toxicity is very much a possibility, and side effects are often seen. So therapeutic indices and margin of safety, we've talked about this before. If we have a low therapeutic indice of like a 3, that is pretty dangerous, and they're more toxic. So remember our toxic dose or lethal dose over effective dose, which tells us if it's a bigger number, that means the toxic dose is farther away from the effective dose. Side effects. So some common side effects we'll see with chemotherapeutic drugs would be bone marrow depression, or we call this myelosuppression. It reduces circulating neutrophils and or platelets, so it can reduce clotting. It can cause anemia. It can cause immunosuppression. Dogs with continuously growing hair, like poodles, terriers, Old English sheepdogs, dogs that need to be groomed, can lose their hair as a result of chemotherapy, but most dogs with fur do not. Cats can lose their whiskers and guard hairs, but again, they don't usually use their fur. Cystitis can be caused by chemotherapy. Also, cardiomyopathy, it greatly affects the heart. They can have anaphylactic reactions to the drugs, and then also, if we have extravasation of the drugs, we can get tissue damage because chemotherapy kills cells. It targets growing cells, actively replicating cells, depending on the phase. It could be the S phase, which is DNA synthesis. It could be the M phase, which is mitosis, where we have the chromosomes lining up and then splitting. It could be G1 and G2 phases, which is when we have RNA synthesis. It can also make the tumor more susceptible to radiation, or can kill cells in the tumor. So it can do one of those two things. Some possible side effects would be anorexia, vomiting, diarrhea, myelosuppression, and loss of hair only in dogs. So if we have dogs that have hair, loss of hair. Cat, whiskers and guard hair, cystitis, cardiomyopathy, tissue damage due to extravasation of the medication. Now we're going to talk about specific chemotherapeutic drugs. First category, alkylating agents. These are cell cycle non-specific drugs. They change DNA linkages, so they cross-link strands of DNA and upset the structure. So they inhibit replication, which causes cell death. We use these to treat lymphoproliferative neoplasms like lymphosarcoma, osteosarcoma, hemangiosarcoma, squamous cell carcinoma, and as well as treating some immune-mediated diseases by causing immunosuppression. Side effects would be neutropenia, nephrotoxicity, thrombocytopenia, vomiting, and hemorrhagic cystitis. Cytoxan or cyclophosphamide is one. Leukeran or chlorambucil tablets is something we use often for immunosuppressive effect. The neutropenia side effect is used to our advantage when treating immune-mediated diseases. We use Cytoxan and Leukeran for those. And there are some others I've listed here just for your information, but these would be the two that I would remember. Next, Anthracyclines. These are derived from the soil fungi of Streptomyces genus. Adriamycin is one of these. Adriamycin is also known as doxorubicin. It's very common, one of the older medications. It is cell cycle non-specific. It binds with DNA and interferes with the RNA and protein synthesis. Commonly used in combination with other cancer drugs. It is a very common drug used in many protocols. It treats like lymphosarcoma or lymphoproliferative neoplasms and various carcinomas and sarcomas. We do get bone marrow suppression, cardiotoxicity. It affects it's a cardiomyopathy, causes cardiomyopathy. But there is a drug called dexrazoxane, which is an antidote to that. Okay, so that's the antidote. Dexrazoxane is the antidote for doxorubicin. Can also cause gastroenteritis, tissue sloughing at the extravasation site, and anaphylaxis. We always want to treat with an antihistamine. Okay, so doxorubicin is the most common. That's the one I want you to remember. We want to protect the heart with dexrazoxane and prevent anaphylactic reactions with antihistamine. Antimetabolites, next category. These are cell cycle specific drugs that affect the S phase, or the DNA synthesis phase of the cycle. They look like purines and pyrimides. These are very specific organic structures. So they are incorporated into the DNA molecule by inhibiting the protein and enzyme synthesis. Again, used to treat lymphoproliferative neoplasms, GI and hepatic neoplasms, and CNS lymphoma. Side effects is about the same: anorexia, nausea, vomiting, diarrhea, bone marrow suppression, hepatotoxicity, and neurotoxicity. Again, they're used to treat hepatic neoplasms and CNS, so they're going to kill other things in there as well. I think, let's see, some of the ones that we see, cytosol-U and fluorouracil, which is contraindicated in cats. And we see this used often with humans, and so we have to be careful of toxicity with their pets with that. So methotrexate, cytosol, and fluorouracil. Antitubulin agents. These come from periwinkle plants. That's why I have this on the periwinkle plant, or the vinca-rose plant, with a periwinkle background. They're thought to bind microtubular proteins that inhibit the formation of the mitotic spindle. So they stop the formation of those tubes that hold the spindles together. It suspends mitosis in metaphase. They treat lymphoproliferative neoplasms, carcinomas, mast cell tumors, and splenic tumors. Side effects are about the same. This one will cause some alopecia and peripheral neuropathy as well. Oncovin, or vincristine sulfate, vinblastine. These are two, vincristine and vinblastine, are two very common drugs in this category. Taxol is something used for breast cancer in humans. We're using it as an investigational drug in animals as well. Some other miscellaneous antineoplastic drugs. There are platinum drugs. These all have plat in their names, carboplatin and cisplatin. They treat solid tumors like osteosarcomas and carcinomas. They do have renal toxicity, nausea, anorexia, vomiting, and cisplatin is contraindicated in cats. Okay, dyspnea. This is dyspnea, not dyspnea. Dyspnea, pulmonary edema. So carboplatin and cisplatin are platinum drugs. They're made with platinum. They interrupt DNA replication. Asparginase is a miscellaneous antineoplastic drug very commonly used in combination with other agents. It comes from E. coli, comes from fecal material, okay? It breaks down aspargine, which is a needed amino acid, so cells will die. We use it to treat like lymphoma or lymphosarcoma, and if they have a side effect, it's mostly going to be an anaphylactic reaction or GI disturbances. You may know this drug as Elspar. Glucocorticoids. Again, we can use prednisone for just about anything. These, when they're used as antineoplastics, are non-specific on the cell cycle. They have a lympholytic action. They're just going to blow apart lymphoid neoplasms. They're helpful in the management of secondary complications of neoplastic diseases such as hypercalcemia and immune-mediated problems. They also help to increase appetite and overall feeling of well-being in patients. So we use prednisone or prednisolone. I will caution you that it is not the first drug that we're going to use when we are treating a neoplastic disease. We always want to diagnose the disease before we start the animal on prednisone. Piroxicam is also known as Feldene. This is a non-steroidal anti-inflammatory. It's more often used, except it's not used as often as an NSAID. It's used more often for its anti-tumor effects via the immune system, just because of the cost of the product. It's very helpful with transitional cell carcinoma of the bladder and squamous cell carcinoma in the dog. So this is something I will use with prostate cancer or with bladder cancer. And it's a non-steroidal anti-inflammatory, so we don't see a lot of side effects with it. Two other medications, hydroxyurea for the treatment of polycythemia vera, which is when we have a ton of cells built up in the bloodstream. It's a really weird disease, also myeloproliferative diseases. It's immunosuppressive. And then procarbazine, which is for the treatment of lymphoma. Now we're going to talk about biologic response modifiers. This is kind of the future of what we're seeing with anti-neoplastic medications. Biologic response modifiers alter the relationship between the tumor and the host animal in a way that improves the host's ability to mount an anti-tumor response. It's an adjunct to conventional chemotherapy, not used as the sole agent. We can use monoclonal antibodies. These are produced by a hybridoma, and these have a seek and destroy action. They have identical immunoglobulin molecules formed by a single clone of plasma cells. So we will create this plasma cell that is very specific to a specific tumor in the body. So it's a very tumor-specific antibody. They have direct cytotoxic effects on tumor cells or are attached to other chemotherapeutic agents for direct delivery to the tumor. There's nothing available for animals at this time, but if we can use this, if we have a tumor in the body that we need to target, these monoclonal antibodies will take the drug directly to that tumor. And that can be very helpful because it's not going to have cytotoxic effects on other cells in the body. Interferon is something that we've talked about as an antiviral medication used for FELV and FIP in cats. It is a chemical that's produced by leukocytes, fibroblasts, and epithelial cells. It's anti-tumor, antiviral, and has some immunoregulatory effects. It increases survival time in feline leukemia and FIP cats. It can cause flu-like symptoms in humans. Some examples would be Rofiron, Intron, Alpharon, Verbagin, and Actimmune. Some other modifiers. Ace-mannan treats fibrosarcoma in dogs and cats. And then interleukins. There are 17 that are identified in the body with different functions throughout the immune system, including cell enhancement, hemopoietic growth, and regulation of leukocyte function. Interleukin 2 promotes clonal expansion of antigen-specific T cells, so they're going to specifically target certain cells. Granulocyte colony stimulating factor affects specific myeloid cell lines, so they're helpful for feline panleukopenia and neutropenia, treatment of neutropenia. There's also bacillus, which activates B and T cells. A bacillus is a bacteria. Okay, the specific strain activates B and T cells. Levamisole, you may have heard of. We think it is an immunostimulant. Propionibacterium acnes, or immunoreglin, is a non-specific immunostimulant, so it's going to get the bone marrow going. Staphylococcal protein A initiates T and B lymphocyte proliferation, so it's a stimulant. Parapox ovis virus modulator treats horses with upper respiratory infections by stimulating their immune system. And then we have lymphocyte T cell immunomodulators for the treatment of leukemia FIV. And the canine melanoma vaccine is under conditional approval for canine melanoma in dogs, and it again is something that's in this interleukin category. Immunosuppressive drugs interfere with one of the stages of the cell cycle or by affecting cellular messengers. We use them to treat immune-mediated disorders like lupus erythematosus, lymphocytic plasmacytic enteritis, rheumatoid arthritis, immune-mediated skin disease, and hemolytic anemia. Immunosuppressive drugs, they're designed to treat these immune-mediated disorders that have the immune system that is kicked up and is causing, it's so kicked up it's actually causing more damage to the system, to different aspects of the system. So some of these include azathioprine. This is an anti-metabolite that inhibits the S phase of the cell cycle in both T and B lymphocytes and causes immunosuppression. We've talked about it before when we talked about anti-metabolites. We do use it with prednisone and prednisolone so we can lower the dose of it. It's contraindicated in cats. Cyclosporine is made from a fungus. It inhibits the proliferation of T lymphocytes, and we use it to prevent organ transplant rejection for immune-mediated skin disorders, atopic dermatitis. So if we have an inflammation due to an immune response to allergens, and then also for KCS, keratoconjunctivitis sicca or dry eye. This can cause nephrotoxicity, hepatotoxicity, nausea, vomiting, and anaphylaxis, so we do need to be careful when we use it. Metronidazole, it's a flagell, it's antibacterial, it's antiprotozoal, it's also immunosuppressive, so it has anti-inflammatory capability. Sometimes used with steroids to enhance this immunosuppression. We'll use it to treat lymphocytic plasmacytic enteritis in dogs, giardia, anaerobic bacterial infections. Side effects would be GI upset, neurologic disturbances, and lethargy. Cyclophosphamide is a alkylating agent. We just talked about it with that category. It's antineoplastic as well as immunosuppressant, but it does have severe side effects. Corticosteroids are immunosuppressant. They're anti-inflammatory and immunosuppressive depending on the dose that you give it. They inhibit neutrophils, T lymphocytes, blood vessels, and cellular messengers, but it is very dose dependent. Some others would be tacrolimus, which is a topical for atopic dermatitis, pimecrolimus, which is the same, and Apoquel, which is oclactinib, which controls pruritus. And then there's mycophenolate motellol, which is immune-mediated hemolytic anemia, IBD, or myasthenia gravis. These are all immune-mediated diseases. So, a lot of categories. Again, you want to put everything into its own category. Know that category well, what it does, how we use it, what are some side effects. And let me know if you have questions.